Hi everyone, and welcome to another one in our lectures for community health. Today we're going to be talking about community organizing, community building, and health promotion programming. So let's get started. So today we are going to discuss the socio-ecological model of behavioral influence. We'll go over some important terms you need to know. We're going to discuss community organizing and community building, and we're also going to provide an overview of the health promotion programming process. So just something to keep in mind as we continue through this lecture, and we will come back to this, is that there are really well-defined steps that community and public health professionals go through to tackle many of the health issues that face our communities. Simply put, it's the first thing is you just identify a problem, like what's going on, where do we see the problem? Do we see people who have diabetes at a higher rate here? If so, let's develop a plan of attack for the problem. You have to do research on find out why there's a higher rate of diabetes in whatever community you're in or whatever illness you're talking about. And then you have to say, okay, well, this is the angle at which we want to attack the problem. The next thing that's really important is that you have to gather resources to carry out the plan. I mean, obviously you can't do much without either money or social capital or actual physical space to do things in. So you have to make sure that the reality, the practicality of the situation is addressed. Then, of course, you do it. You go about it and you implement that plan. But it doesn't end there. You also have to evaluate the results. So this turns into a cycle, and we will see this graphically depicted later on in the lecture, but it's something that can be repeated over and over and over again to attack a problem and really hone in on the best way to attack that problem. So a lot of the times at the core of community organizing and building and health promotion programming, we're targeting behavior change. And when we talk about behavior, it's not something that people might be doing wrong. It's just like we have to make it friendly for people. So this is our socio-ecological model of behavior influence. And we can see that there's a lot of circles within circles. And what does it all mean? So we see that for every health problem, we can see that there is an interaction between different factors within and across all levels of the socio-ecological model. And what do we mean by that? Well, behavior has multiple levels of influence. So when we look at our little circle diagram here, we see individuals. So obviously, individuals can be motivated on their own to change their behavior. There's also the interpersonal level of behavior influence. And that would be like if you wanted to start a walking program, you would get maybe groups of people walking together to better their health. Interpersonal. Organizational would be kind of something within a job, maybe, where they provide financial incentives for hitting certain health milestones or stuff like that. You can find that in many corporate institutions, and perhaps at school, you can see that you've got a free membership to the gym, right? So that's organizational. They're just making it really easy for you to attend the gym for your health, for your stress levels, all that kind of good stuff. There's also the community level. You can see that this might be kind of like a park district or something like that puts together programming for fitness and health. There's the policy level where these things can be influenced, and very effective policy is to make bike lanes in a community so that people can bike from one place to another so that they don't have to drive everywhere. If you have protected bike lanes, then people are encouraged to use them and bike to run their errands. You can also see that the culture is another level of influence, and the physical environment is a level of influence. So, behavior change is usually a combination of individual and all of these different levels, usually environmental or policy level, but it trickles all the way through this model. So here are some important terms to know. So community organizing or community building, we can use these two terms interchangeably. And this is the process through which communities are helped to identify common problems or goals, to mobilize resources, and develop and implement strategies for reaching the goals they have collectively set. Now, community organizing and community building, it's not a science, but it's an art of consensus building among the people in that community. Community capacity. These are the characteristics of a community that affect its ability to identify, mobilize, and address problems. So when we're talking about community capacity, we are asking the question, does the community have the resources, including human and social capital, to achieve its goals? More important terms to know, we have empowerment. So this is the degree of autonomy and self-determination in people and in communities. Empowerment enables people within those communities to represent their interests in a responsible and self-determined way, acting on their own authority. And there's also grassroots participation. So these are the bottom-up efforts of people taking collective actions on their own behalf, as opposed to actions that are something like rules or regulations being imposed on a community from the top down. Couple more terms. We have systems change. Systems change is a change in organizational or legislative policies or in environmental supports that encourages and channels improvements in systems, community, and individual level health outcomes. And then finally, we've got social capital. So these are the resources available to people and entities because of their networks. And so here's just a little graphic of social capital. So we have citizen power, participation, reciprocity, which is like you scratch my back, I'll scratch yours, feelings of trust and safety, networks, bonding, bridging, a sense of belonging, diversity, you have similar values, norms, outlook of life. You just want like the people capital there to help you get your job done. So then we have to ask, is there a need for organizing communities? Well, big time nowadays, because we've changed our sense of what community is within the past 100 years or so, right? So changes in community social structure have led to a loss of a sense of community. And this is due to anything like advances in electronics, communications, increased mobility. People are going here and there, perhaps not staying in one place for very long sometimes. And community organizing skills extend way beyond community health. So even if you don't go into a healthcare field or even community health, you'll find that community organizing helps in all aspects of working with other people and advocating to get the things done that you need to with a group of people. We have 7 assumptions when it comes to community organizing, and these are interesting and give you good perspective on what community organizing, community building entails. So the first assumption is that communities of people can develop the capacity to deal with their own problems. The second one is that people want to change and can change. The third one is that people should participate in the making, adjusting, or controlling of the major changes that take place within their communities. The fourth one is that changes in community living that are self-imposed or self-developed have a meaning and permanence that imposed changes do not have. You know, if you decide to do something for yourself, this is something that you're going to do and you're committed to do something. The same thing works in the community setting. It means something to you. That if somebody tells you you have to do it this way, you're not really buying into that. Number 5 is a holistic approach can successfully address problems with which a fragmented approach cannot cope. So we want to look at things as a whole and see how they are interconnected rather than trying to address one little problem here, one little problem here, one little thing here, and kind of like have a patchwork of solutions, like a bunch of Band-Aids. We want to see what the big problem is. Democracy, number 6, democracy requires cooperative participation and action in the affairs of the community, and people must learn the skills that make this possible. And the last assumption of community organizing and community building is that frequently communities of people need help in organizing to deal with their needs. Just as many individuals require help in coping with their individual problems. So the process of community building is a cycle. The first thing that we do in our community building process is that we recognize an issue that we care about. We are either a part of this community or we see from the outside a concern in a community that we would like to address. So if you're outside that community, you need to somehow gain entry into that community. You need to gain the trust of the community members, and you need to work with that community. Then we organize the people. You assess the community capacity to deal with their own problems. You determine priorities and set goals. Then you select intervention strategies. Then you implement those strategies. And then you evaluate, adjust, and begin again. And this process is a cycle that can get more honed over time to deal with certain issues that are plaguing a community. So now we're going to switch a little bit to health promotion programming. So this is 1979. This is a Surgeon General's report. It's Healthy People, which, as you recall, we do have the Healthy People 2030 framework right now, which our nation is working toward. So this was Healthy People in 1979. This is the Surgeon General's report on health promotion and disease prevention. This kind of switched our focus from curing disease to preventing disease. And so since then, like I say, the major focus of public and community health has been on prevention. So health promotion programming has become an important tool of community and public health professionals. And when we talk about health promotion, we're talking about any planned combination of educational, political, environmental, regulatory, or organizational mechanisms that support actions and conditions of living conducive to the health of individuals, groups, and communities. So here we see another cycle. This is a cycle for creating a health promotion program. And the first thing that we do when we're trying to create a health promotion program is a needs assessment of a priority population. What are the needs of this community? Then our second step is to set goals and objectives. We then create the intervention. Then we implement the intervention. And then we evaluate the results. And this, again, is a cycle that we can keep repeating over and over again. Evaluating the results and putting into practice what you find from your evaluation for the next go-round makes the health promotion program even better and even more successful every time, hopefully. So we'll go through these one by one. So the first one is a needs assessment. So a needs assessment is a formal analysis and prioritization of the needs of that particular population. So you're going to have to determine the purpose and scope of the needs assessment before you even start the needs assessment. Then you gather data. You analyze that data and determine the resources you have available to address that need. You identify the risk factors related to that health problem, and then you identify your program focus. The last thing you do is you validate the prioritized need. Is this a true need? Will our program address the need? Is there anything else required to address the need? And this is all in your needs assessment. The next thing you do is you set goals and objectives. So when we set goals, this is the terminology in the community and public health sphere and in a lot of the corporate cultures as well, is that you set SMART goals. SMART goals, SMART is an acronym. SMART, S stands for specific, M stands for measurable, A stands for attainable, R stands for relevant, and T stands for timely. So these are the type of goals that you're going to want to set when you're creating a health promotion program. We also have different kinds of objectives, and your homework this week is going to focus on some of these objectives. So we'll just go through this table real quick. This table tells us something about these types of objectives that we have. And we have process objectives, impact objectives, and outcome objectives. We want to see what our program outcome is that aligns with each of these objectives, and we'll go through this further. I'm just giving you the overview right now. We can see possible evaluation measures for each of these objectives, each of these types of objectives. And remember, the evaluation measures are important because they tell you whether something is working or not, and then you can go back and re-implement the things that are working. You can change the things that aren't working, stuff like that. Type of evaluation. So obviously it's process in the process objectives, impact in the impact objectives, and outcome in the outcome objectives. And then we have an example objective just to try and make it all make sense. So let's say we're looking at process objectives. What are process objectives? Well, these are activities presented and tasks completed. So when you're implementing a health promotion program, you're designing it, you have to actually design very carefully what your expectations are. So if we're looking at activities presented and tasks completed, you're going to measure the number of sessions held, the exposure, the attendance, the participation, the performance of the staff, whether you have the appropriate materials or not, whether you have the appropriate resources, and whether you're completing your tasks on a schedule. An example of this type of process objective is, and here's your objective, during the next 6 months, a breast cancer brochure will be distributed to all female customers over the age of 18 at the Ross grocery store. So obviously this is a health promotion measure that is being put in place to try and prevent breast cancer. So another example is in these impact objectives. So let's look. We have 3 different impact objectives. We have learning objectives, we have behavioral objectives, and we have environmental objectives. And our program outcomes for each of these is, for learning objectives, we're going to see change in awareness, knowledge, attitudes, and skills. For behavioral objectives, we're going to see a change in behavior. For environmental objectives, we want to see a change in the environment. So how are we going to measure these things, if they are taking place or not? I mean, this is our goal. We want to achieve these objectives. How do we know if these objectives are measured or are being achieved? Well, we're going to measure them. We're going to say, is there an increase in awareness? Is there an increase in knowledge? Are attitudes and skills being developed? That's what we're going to find out about our learning objectives. So then we see an example of a learning objective is, when asked in class, 50% of the students will be able to list the 4 principles of cardiovascular conditioning. So obviously this learning objectives has something to do with teaching cardiovascular conditioning. And so we want to see, is there an increase in awareness? Well, yeah, because we see that after these learning materials are presented, 50% of the students should be able to list these principles. And then we take an actual measurement. If we find that only 40% of the students are able to list the 4 principles, then we're not achieving our goal. If we see that 60% are listing the 4 principles, then we are achieving our goal and we're exceeding it. The next one, again, in the impact objectives are behavioral changes, right? So how are we going to measure this? Well, we're going to see if our current behavior is modified or discontinued, or if a new behavior has been adopted. So an example objective for this is during a telephone interview, 35% of the residents will report having had their blood cholesterol checked in the last 6 months. So obviously this is an outreach program to get people to have their blood cholesterol checked. So they want to do this health promotion program. And then afterwards, when they call people on a telephone interview, they want at least 35% of those people to report that they had their blood cholesterol checked in the last 6 months. And again, if it's less than 36%, then they're not achieving their objective. And if it's more, then they are achieving their objective. The last of the impact objectives are environmental objectives, and we want to see a change in the environment. How are we going to measure this? Well, we can measure things that are associated with economic, service, physical, social, psychological, or political environments. For example, we can see, is there protection added to something, or are there hazards or barriers removed from something? Okay, so an example of this one would be, by the end of the year, all senior citizens who requested transportation to the congregate meals will have achieved it or received it. So this is a removal of a barrier to getting these meals. So they want to change the environment so these senior citizens can get rides to go get their meals. Finally, we have outcome objectives. And these program outcomes are a change in quality of life, which we abbreviate as QOL, a change in health status, a change in risk, or a change in social benefits. So measures, we can measure quality of life by looking at morbidity data, mortality data, measures of risk, things like that. There are all sorts of measures that we can use. We can use those disability adjusted life years and the health adjusted life expectancy, all those things from, I think that was from our epidemiology chapter. And so here's an example of a change in quality of life objective. By the year 2020, infant mortality rates will be reduced to no more than 7 per 1,000 in Franklin County. Okay, that's distinct, that's measurable, it's clear. These are objectives of public health and community health promotion programs. So in your homework this week, you're going to pick a community health intervention, and you're going to give me an example objective for each of these boxes here. So then we move on to step number 3, and that is actually creating the intervention. So an intervention is one or more activities designed to create change in people. There are several questions that we need to consider when we're creating the intervention. First, what needs to change? Second, where is change needed? Third, at what level of prevention will the program be aimed? So remember, we talked about primary prevention, secondary prevention, tertiary prevention. So you need to decide at what level your program is going to be aimed. And at what level of influence will the intervention be focused? So we're going to refer back to the socio-ecological model, all those circles within circles that we talked about at the beginning of this lecture. So this would include the personal, the interpersonal, the organizational, community, policy, the physical environment, culture, stuff like that. We're going to do some research and say, has an effective intervention strategy to deal with this problem already been created? I mean, if there is a program that's already been created and it works, then we can try it in our own community, see if it works. You want to know, is the intervention appropriate for the priority population? So if you're trying to curb underage drinking in a population, you're not going to be like, well, we got to higher the drinking age or something like that, because that wouldn't be an appropriate intervention. That would really just maybe increase the amount of underage drinking. So you'd have to really make sure the intervention matches the population. Are the resources available? Now, this is the number one, almost most important thing, because you can't do anything if you don't have the resources. Like if you want everyone to congregate together to get a blood pressure screening, you need an actual physical space for that to take place. You need to have some social capital. Who do you know that knows people who know how to take blood pressure and can come to this physical space that you have, right? You need the equipment. You need all the blood pressure monitors. You need all the resources to implement your intervention. Lastly, you're going to consider whether you're going to use a single strategy to achieve your goals and objectives, or maybe multiple strategies like overlapping, would work better. So just a reminder of that socio-ecological model and all those circles in it, behavioral influence. And the next thing is implementing the intervention. So implementation is putting a planned intervention into action. That one was simple. Now we're going to evaluate the results. So there's a few steps involved in evaluating results. The first thing we're going to do is we're going to engage the stakeholders. Stakeholders are those who are involved in the creation and delivery of the program. They also include those in the priority population. They also include those that will use the evaluation of the results. And there may be even more people that you can include as stakeholders in your health promotion program. So you're going to engage those stakeholders. You're going to describe the program with your well-written goals and objectives. You have those written out ahead of time, right? Step 2. So in evaluating the results, you're going to re-go over your well-written goals and objectives, and you're going to relay that information to the stakeholders. You're going to focus the evaluation design. So how are you going to evaluate your program? First of all, you have to say, what is the purpose of your evaluation? Are we looking for quality improvement? Are we looking to assess the effects and we want to improve the effects? Are we looking to engage more people? Like, what are we evaluating our program on? And step 4 is to justify the conclusions. So you're going to analyze and interpret your data, right? So you've collected data about what was going on. Did you achieve your goals and objectives? You're going to analyze, yes, we did, no, we didn't, and we're going to interpret the data. Well, in these areas, we exceeded our goals, and in these areas, we fell short. So interpreting the data is just like, what do we do about it? Then you share those lessons learned. You share them out with the community. So that is our 5 steps of creating a health promotion program. Needs assessment, set goals and objectives, create the intervention, implement the intervention, evaluate the results, and start all over again. And I just wanted to give you a little example of a community health intervention that's going on in Chicago.
The South Side of Chicago is a very large community. There's roughly about 900,000 people who live on the South Side. They vary in income from $10,000 a year for a family of 4 up to $200,000+ for a family of 4. Children on the South Side of Chicago have a prevalence rate of asthma at about 17% compared to 9% across the country. There are communities on the South Side of Chicago where 59% of the kids have asthma and miss school on a regular basis because of asthma, or end up in the emergency departments across the South Side of Chicago because of asthma conditions.
It means missed days off of work for the parents, missed days of school for the child, and really can bring an economic issue to the community because of all of those. And we have actually higher death rates due to asthma in our children. Losing a child too young to something that we can prevent is something that affects all of us.
Hey, hi, how are you guys doing?
Asthma is an inflammatory disease of the airways, or the breathing tubes of the lungs. It can cause permanent changes in those airways if left untreated. So with early treatment, we can have better outcomes. We are working to bring improved care to asthma in the community itself as a community effort to reduce this asthma epidemic that we are currently in.
We do things from sharing the data and information on asthma in our community. We develop programs together to treat asthma and to care for persons with asthma.
We're working with Respiratory Health Association, Chicago Asthma Consortium, Urban Health Initiative, Larabeta Children's Hospital, and Friends Family Health Center, to name but a few. We have 4 pillars of excellence. The first pillar is clinical, both inpatient and outpatient. The second pillar is education, bringing education not only to the child, but to the family, the community, and other healthcare providers. The third pillar is our community outreach and our community partnerships, especially with the schools and churches, to not only provide clinical care, but education, and to bring back knowledge translation. The fourth pillar is that knowledge translation or research, so that we can improve asthma care, diagnosis, and treatment down the line.
On the south side of Chicago, we have been able to work with the mobile medical unit, and we have been able to go to the Chicago Public Schools to help educate family and students, as well as to attend church events and health fairs to educate them as well. I truly love being able to teach parents and children the appropriate medications, making them aware of what the signs and symptoms of asthma are, how to treat them, and getting them to be able to identify and get treatment appropriately.
The research that we're doing in the schools in Chicago centers around working with schools to identify best practices and resources to help implement existing policies and new models of care so that children with asthma have the best quality of life and education throughout their school years. An example of research we're doing in terms of a specific project is starting at the beginning. We need to actually identify children who have asthma to best provide the policies, the programs, and the resources so they can get that optimal care. And what we truly hope to develop are pragmatic evidence-based models so that kids with asthma have the same experiences in school that those without asthma do.
So these are both your pumps, right?
Yes.
Okay.
I have a one child at a time philosophy for asthma management. My belief is that when you change the life for that one child, they're able to play, they're able to go to school, they're not hospitalized. So not only have you impacted the quality of life for that one child, but they'll now go and tell their friends, hey, my asthma's under great control. And their friends will sit there and say, hey, I want my asthma under great control. And they'll talk to their parents and it'll come back.
Coma Children's Asthma Center, it's a great development for the community because what it is doing is trading on the strengths of the university, which is collaboration. And this pulls in people from multiple disciplines and is intended to work through the community and to increase and improve the outcome for children while integrating the community with the powerful research and clinical care that takes place at Coma Children's Hospital.
Okay, and that concludes our presentation on community organizing, community building, and health promotion programming.